Hello, this is the Cancer Answer Man. I'm Dale Black, cancer researcher, author, Christian cancer coach, and pastor. After my wife was diagnosed with terminal cancer, I felt led of God to become a full-time cancer researcher, to find answers to the battle we were facing. And when all the dust settled and my wife had completely reversed her cancer without chemotherapy, without radiation, and without drugs, we declared it victory. Now that was 18 years ago. As a former airline pilot and jet flight instructor, I'm used to analyzing situations and solving complex problems. Learning about cancer, what it is, what causes it, how to reverse it, was something in a sense I'd been trained to do. Today I'm going to share with you some great questions and answers that are important to review if you or a loved one has been diagnosed with cancer. In fact, any form of cancer. So, let's get started. Here's question number 1. I was told by my doctor that I will need both chemotherapy and radiation as treatment for my recent diagnosis of cancer. Will these treatments really make me well? Well, sadly, the answer to that is amazingly no. Absolutely not. But there is hope. It is not possible for chemotherapy or radiation to make your body well. These treatments do not and cannot heal. In fact, even the medical profession admits that both of these treatments can cause cancer. It's true, radiation and chemotherapy kill some of the fast-growing cancer cells, but drugs do not cure disease. Drugs only treat symptoms, and all prescription drugs, including chemotherapy, have adverse side effects. You'll see patients who recover, or whose cancer goes into remission, they say, and some will be called survivors if they live long enough. But that's not a solution. Believe me, you must not be fooled. It's necessary to look more deeply to find the whole truth for your healing. These medical procedures also kill a great number of good cells, crucial cells that are needed. Some of these make up the vitally important immune system. And that's the only system that will actually destroy cancer cells naturally. Now, God designed your immune system. He designed it, and it's there to fight disease in your body. For you to get well, that system must be nourished, not depleted or destroyed. You may hear these words and scratch your head in confusion. When I first learned this, that's what I did. But it makes sense when you review all of the pieces of the puzzle. Yeah, it's true. Some cancer patients survive the chemo and or radiation treatments, but little of their immune system is still intact at the end of their treatments. You will never truly get well with a damaged or depleted immune system. Question number 2. What about radiation alone? My doctor is recommending radiation treatments, but not chemotherapy. Okay, here's the answer. It's a good question. Your doctor's goal is to shrink the tumor. Unfortunately, tumor shrinkage, if I can say that right, does nothing to actually cure cancer. Radiation does not attack the root of the cancer problem. The medical industry treats the tumor as if it's the cancer. I want to say that again. The medical system treats the tumor as if that is the cancer. And that's just ridiculous. Tumors are a symptom of the cancer, but they're not the cancer. Using radiation therapy is like fighting a forest fire with a shotgun. It's just the wrong weapon. And not only does radiation not attack the root problem, it causes extensive collateral damage by destroying or damaging tens of thousands of good, healthy cells which are trying to fight off the disease in the patient's body. So in the process of irradiating the radiation, the cancer tissue, good tissues are obliterated and the immune system is depleted. Sometimes it's completely destroyed. And a final word on radiation. Radiation actually causes cancer. Radiation actually causes cancer. There's not one situation in which I would ever suggest radiation treatments. To me, this is more than maddening. It's criminal. Patients expect their doctors to cure them, yet the doctor is not treating the cause of the cancer. Shrinking the tumor should never be the goal, yet, sadly, it is the goal of most of the medical profession, while leaving the cause of the cancer completely undealt with. In your doctor's defense, your doctor usually isn't aware of the real solution, but is simply doing what he or she has been trained to do. Question number 3. But don't some cancer patients actually get well after having chemotherapy and/or radiation? And here's the answer to that one. Some patients may appear to get well for a time, but this is often temporary. Perhaps the tumor is gone and the blood level checks indicate that the person is cancer-free. But cancer often remains in their system, not only in the form of stray cells, but in the overall condition of the body's system. This is because cancer is a systemic disease, which affects the entire body system, not just the area in which the tumor appeared. For more on this, you want to read the breakthrough book called Life, Cancer, and God. And you'll also find an appendix inside here that tells you exactly what my wife and I did to reverse her cancer, and she's been in vibrant health ever since. Now, when the patient ultimately recovers from chemo and/or radiation treatments, it's the patient's immune system that has accomplished this feat, not the chemotherapy or the radiation. The chemo and radiation simply shrank tumors, and they do kill fast-growing cells, and cancer cells are indeed fast-growing cells. The reason the chemo and radiation is not the permanent cure is because the patient has had major destruction to the body's God-given immune system on the cellular level and can no longer fight the cancer cells naturally from within. Here's another question. Hey, cancer answer man, my tumor is small and self-contained. If I just have surgery without chemo or radiation, won't that be enough? Well, here's the answer to that one, and again, a very good question. Thanks for sending that in, by the way. There are 2 reasons surgery alone is not a good answer. First, surgery often releases cancer cells into the blood or lymphatic system. From there, they often travel to another location and set up shop, forming a new cancerous tumor. Even simple diagnostic procedures such as needle biopsies, which I'm completely against, even that procedure can cause cancer cells to spread. Second, since a tumor is a symptom of cancer but is not the cancer itself, then steps must be taken to rid your body of the conditions that caused cancer in the first place. Again, this is because cancer is a systemic disease which affects the entire body system, not just one area in which a tumor appeared. Here's another question, and again, a good question. What causes cancer in the first place? Isn't that what we all want to know? It's important to understand that all people have cancer cells in their body. In their bodies, even babies, yet not everyone gets cancer, of course. You see, your immune system kills cancer cells on a continual basis. even when you're well, especially when you're well. Cancer symptoms, such as tumors, occur when your immune system is compromised and it's unable to keep up with the information, or I should say with the formation of cancer cells. Cancer begins on the cellular level, and it's related to how our cells, and therefore our immune system, is nourished. The shocking truth is that we give ourselves cancer, and other chronic diseases for that matter. We give ourselves cancer by the way we think, by the way we live, by the way we eat, drink, and in how we handle stress. For an in-depth look at how this occurs, make sure you get a copy of Life, Cancer, and God. If you'd like to learn more, go to daleblack.org, and you may wish to check out our Cancer Coaching Ministry. Thanks for listening. Remember, with God, nothing is impossible.